Breakthrough cases are on the rise. It's something that Duke University officials are dealing with right now.
Yeah, 364 students and staff there tested positive for COVID-19 over the past week. Only 8 were unvaccinated. CBS 17's Haley Fixler is live on campus for us tonight. And Haley, you talked with an epidemiologist today. How concerned do we need to be about this?
Well, not really concerned. None of the students here at Duke were reported to be very sick. While it is still possible, if people are vaccinated, they have a very little chance that they will go to the hospital or die. Now, the doctor I spoke with said that COVID is not going to go away anytime soon, but he did say that we need to reframe the way that we think about vaccines and realize we can still get sick.
I do think an indoor mask mandate should be statewide.
It's a simple change that Dr. David Weber with UNC Health says could make a big difference. While vaccines are the first defense against the virus,
that is the single best protection we can offer people.
It may not be enough. Transmission rates are high all across the state. The latest data from the state health department shows 18% of COVID cases are breakthrough cases. That means those people got vaccinated and still got the virus.
The Delta variant is more similar to mumps and chickenpox, meaning about 8 people I would infect, so it is more transmissible.
Even if someone is asymptomatic, they could still pass the virus to someone else who ends up getting sick. That's why he thinks there needs to be better policies in place.
I think a mask mandate for masks indoors should be instituted across the state, either by the state or every county. And when you can't wear masks indoors, to physically distance a minimum of 3 feet or 6 feet from others.
Weber says testing should be used to help detect breakthrough cases and not as a proactive safety measure.
That's a way of controlling spread, such as you might do in an Army barracks, a cruise ship, or in a college dormitory. But testing itself is not a way of preventing COVID.
I had to reach out to state health leaders this morning asking if they're considering implementing any more policies to help prevent a further spike of cases. I have not yet heard back. Dr. Weber also told me it's really going to be on us and our behaviors to make sure that we're acting responsibly and we're not contributing to the spread of the virus. Live in Durham, Haley Fixler, CBS 17 News.
All right, Haley, thanks so much for that live report.
Now, Duke University will require masks